Welcome back. I'm delighted in the second half of Village in Motion today to introduce our two guests from Home Health. The office coordinator, Stephanie, is it Santiago?
Yes, ma'am.
Stephanie is the office coordinator, and a brand new physical therapist, Brandy O'Brien. Welcome to both of you.
Thank you.
Thank you.
Glad to have you. You know, I think just as a quick reminder of what home health provides here at Greenspring, would you like to tell us what services you offer, Stephanie?
Sure, absolutely. In home health, we offer skilled nursing, physical therapy, occupational therapy, speech therapy, and home health aides. And all of them, the order has to come from the physician, so it can't be, well, all of a sudden I don't feel good, I want to have services. The physician has to order it and recommend it, and the patient has to be homebound as well.
Yes, all right, and that's an important distinction, that they're homebound. They're allowed to go to church, to the beauty parlor, and I think to meals here.
Yes.
And that's about it.
Yes.
So genuinely homebound, not just I don't feel well today
Correct.
kind of thing. All right, great. Now, Randy, how long have you been at Greenspring?
I've only been at Greenspring for a couple months, but I've been a physical therapist for 23 years.
All right. Where did you come from prior to Greenspring?
Well, I actually own my own outpatient practice.
Oh,
so
you did?
Yeah. So, and I still do. I have 2 outpatient clinics. I just don't see patients as much there, and I wanted to change the types of patients I was treating. So I had done home care in the past, and I wanted to get back into it. So they've been very friendly, and they hired me, which was really nice.
How many physical therapists are there in home health?
We have about 5, 1 full-time, and the rest of the physical therapists that we have all work flex shifts, so on an as-needed basis.
As needed, all right. Well, that would make sense. Randy, you're on an as-needed basis?
Yes, and I've been working 2 days a week, usually Tuesdays and Thursdays. I come in and see about 4 patients.
What kinds of services does physical therapy provide in the home?
Right, so a lot of times the types of patients we're seeing are those people who may have had a recent hospitalization for whatever reason. Could be cardiac, could be orthopedic. And so they may have either been in a hospital, then to maybe a skilled nursing facility, and then they're home, but they're not yet ready to do outpatient services. So when we come into the home, we assess the home for safety, number 1, to make sure that they're safe.
Now that's an important
Yes.
role.
Right, so fall prevention and education are 2 big things that we do, especially on that initial assessment. And then we're also determining as a team, a lot of times, sometimes physical therapy will go in first, sometimes nursing will go in first, but we're doing case management to try to figure out what does this particular patient need and what was their prior level of function, what do they need to get back to. So oftentimes we'll make recommendations that, hey, if they're having issues with dressing and bathing, we'll suggest that occupational therapy come in because they work on those types of things more so than I would as a physical therapist. Or if they're having issues with medication management, because oftentimes your medication changes. You get admitted to the hospital and the specialist doctors might change up your medications, and then you come back. And so then we need to call nursing in to make sure that they're taking their medications as prescribed.
So you're developing a care plan that really is a coordinated kind of effort.
Yes, we work. That's the one thing. Again, I've been practicing in outpatient orthopedics, so it's all PT. But coming here, it's been really, really great because we have such a great team of nurses and therapists, and the management. Everybody just works really well together. There's meetings every week where you talk about the patient and what the needs are and what the plans are. Communicating with the physicians, the family members. Yeah, it's a total team effort.
Well, that all sounds that's all a strong recommendation for using home health here.
Absolutely.
What about hospice patients? Now, are you providing any services for hospice patients?
So as you know, the Greenspring Hospice closed down
Right.
a little over a year ago. So we do not see hospice patients. However, if there is a outside hospice agency currently treating one of our
Right.
residents here at Greenspring, and the resident's family or the resident's familiar with the work that we've done with the resident, they might suggest that we bring in a physical therapist to just assess the patient, and we'll go on behalf of hospice just for that particular case.
I see. All right. So you can provide occasional services to them. Hospice provides really all the services. Is that what you're saying? Nursing, etc.
Hospice provides
Outside agency.
right. They
hospice.
provide nursing, home health, or home health aid under hospice. They provide social work, bereavement counseling, and they do also have physical therapy, but most agencies don't have a physical therapist, so they do outsource to home health agencies
All right.
for assistance.
And it could be you all. All right. Where did you come from originally, Randy? Are you from this area?
I'm not. I'm actually from Pennsylvania, small coal mining town, and I went to college in Philadelphia. But I've lived here for 23 years in Northern Virginia. So.
Where did you do your training?
So I went to the Philadelphia College of Pharmacy and Science and Temple.
And Temple.
Yeah.
I know they've always had a fine reputation.
They do.
Got your PT degree long before a doctorate was required?
Yeah. So when I practiced, when I first went to school, it was a master's program. So I got my bachelor's and master's.
It was a master's.
It was, yeah. So I went to Philadelphia College of Pharmacy for there, and I got my doctoral degree at Temple.
You got a doctorate at Temple. Well, gosh, I'm impressed.
Most PTs have that now. The,
I
the younger
know they
ones
do.
coming out, yeah.
I know they
I had to
do.
go back, so that's okay.
Okay, well that's extremely impressive. What are you finding at Greenspring in terms of, you said mostly post-surgery, orthopedic and cardiac are the two?
Or just a decline in function. I think that's the big thing that people need to realize is that, maybe it was somebody who used to go to the dining hall with their spouse, or maybe they're single and they'd go and meet their friends there. And I think there's people watching who are maybe noticing, hey, Mr. So-and-so isn't coming to dinner anymore.
Right.
And I think it's things like that. It doesn't have to be an overt hip fracture or something like that. Sometimes people just decline in function as we get older.
All right, so it may just be frailty.
Correct.
All right.
And then there might be some underlying issue that's not been addressed yet, right? And again, it could be blood pressure issues, could be other medical management type things that if we go in and make an assessment, we can then determine what the needs are for that particular patient.
All right. Your private practice is orthopedic, strictly.
Yes, but we do see a lot of neurological patients, older individuals come in. Some people just come in again for like fitness, and I think that's a big piece too, is where people, as we get older, we're not doing as much, maybe we're sitting around more, and that's where we have visual changes, so then we'll have balance issues, and that's where the whole fall prevention comes into play. And I think that's a really, really big piece. And I think that our services are probably underserved, and people don't realize what physical therapists can do. And the whole push for that doctoral program was so that we can see patients in Virginia without a physician referral, not in home, but not in home care. In outpatient, we have patients that come in off the street for us to assess them. But I think it's important to know here that you guys have the ability to have access to us, and we communicate with the physician. So if somebody is not feeling well or they've declined in function, that's when they can, reach out to us, and we can probably go through the process of reaching out to the physicians.
All right, I was going to ask you about that. And certainly our medical center physicians are very aware of your services, outpatient rehab services.
There's a lot of communication, and for me, that's been, again, I've been practicing for so long, and in the outpatient setting, I feel like it's very disjointed. You try to communicate, but it doesn't always happen. And the thing that I've loved about being here is the teamwork, the ability to have access to other providers and make sure that the patient's getting the best care.
Yeah, I think it certainly is a huge benefit for we residents.
Absolutely.
That there is this kind of coordination.
Yeah, there's a lot of great therapists and nurses down there, so.
All right. Well, anything you would like to leave us with? Anything particular you'd like to leave us with as a thought?
if you ever feel as if maybe you would need services through home health, the community social workers, Sue, Frankie, Stephanie, Elena, they are also great resources. So you could always talk to them, and they could always talk to us, so we could discuss it and see what we could best do for the resident.
All right, I think that's a very good thing. We forget that they're involved with case management. Absolutely. All right, well, both of you, this has been extremely helpful and interesting. I'm delighted you're here, Randy.
Thank you.
And I think the team probably benefits from his presence as well.